Good afternoon, everyone. Can I just check if everybody can hear me okay? Yep. Thank you. And thank you to Lord Combeck and actually to everybody who has invited us here this afternoon. It's a great pleasure to be here, and as I've been introduced and somebody said to me over the break, there's more Irish and Northern Irish accents here than anything else. That might be the case. I am from Northern Ireland. I'm from Belfast, and I am a psychologist. I'm a forensic psychologist by background and training, and I worked in the criminal justice system for just over 30 years. I'm going to talk to you. I'm delighted to be now the convener, the chair of the Risk Management Authority in Scotland, and it's a great pleasure to be that convener, because during my lifetime as a psychologist and then latterly as the Director of Rehabilitation with the Probation Board across the justice system, I always followed the Risk Management Authority here in Scotland, and I had a very good friend who at one stage actually was the Chief Executive, Roisin Hall. So it was always something that I used to come here and hear about what was going on with the Risk Management Authority, and I used to invite Roisin over to Northern Ireland. And somebody said this morning, you know, we need to do more cross-jurisdictional learning and working, and I think that actually does happen, and it certainly happened a way back, and it continues to. So I'm truly delighted to be the chair and the convener now of the organisation that I admired, I suppose, for many years. And Lord Corbett, you're absolutely right. It's the Risk Management Authority in Scotland, because I don't believe that the Risk Management Authority actually exists anywhere else. It certainly doesn't exist in Northern Ireland, and I don't believe there's an equivalence in the south of Ireland or indeed England and Wales. So it is particularly important, and I think one of the things that that Scotland has very much got right. So it would be remiss of me not to say that 20 years is the year we now celebrate being in existence. The RMA is 20 years this year, and we're delighted. It's a real milestone for us. However, it's an opportunity to be able to reflect through the system in terms of the impact that we have had. And listening to speakers this morning, you know, we've heard various different views on sentencing, on language, on effectiveness, the efficacy, all of those types of things about domestic abuse. And for me, it's about how do we impact, and what does impact actually then mean? So briefly, what I'm going to do is, for those of you who are unfamiliar with the Risk Management Authority, I'm going to give you a very brief overview of what it is that we do. I'm going to talk to you about our strategic vision, what it is for the future. I'm very briefly going to do a bit of a journey through our impact over the last 20 years, and where and how do we make a difference in the system. So where is the dent in terms of all of those things around using our research, using our work to make a difference in terms of rehabilitation and a reduction in reoffending, which is one of the things through my lifetime as a psychologist and as the Director of Rehabilitation was in the title of rehabilitation and the importance of rehabilitation, and the importance of looking at short sentences, short prison sentences, but also alternatives to short prison sentences. And I am delighted that we have some judicial colleagues from Northern Ireland in the audience this afternoon. So if there's any hard questions, I'm going to point you to that back table. So and then looking at how do we influence the learning and the practice across Scotland, but elsewhere. And then I'm going to share just some experiences from a Northern Ireland perspective and how we have made a bit of a dent into the system. And lastly, we've talked about the data. How do we use the data to impact on the ever-changing needs of the population that we're working with? And we heard a question this morning, which I thought was really impactful, about, you know, domestic abuse programmes. Do they happen in prison, or do they just happen in the community? And how do we actually make that? How do we join that up? And also the ever-changing trends in terms of sentencing, but also the complexity of the needs of individuals that are within the justice system, and indeed they are plentiful. So if we look on to then the story, our story begins 1999. As many of you know, the Maclean Committee, established in 1999, was to review and make recommendations about sentencing of serious sexual and violent offenders. It was established in 1999 to consider whether current sentencing options in Scotland were sufficient. In other words, do they meet the needs of the population and those who are convicted of serious sexual and violent offences? Does the practice meet the needs, and indeed where is the treatment, and is the treatment that's available the correct treatment in order to inform the very complex needs of this individual client group? And what are the services, what types of services do we actually need in order to make a difference, to reduce the reoffending of this client population, but also in the long term to rehabilitate them, and most importantly, of what we all need to bear in mind and always keep at the forefront, is the victims and the impact on the victims. And we need to ensure that the efficacy of the interventions and the treatment that we deliver is what works. And many of you here today will probably know about the What Works movement, and that's going back to programmes and interventions way back in the 80s, 90s perhaps. And that was all around risk, need, responsivity, and we heard about that this morning. So in other words, how do we design interventions and programmes to meet the needs of this serious population? And that What Works movement, I think, has certainly shifted now to what works with this population that is ever increasing, complex, and the impact that that client group now actually have on that wider victim. I think victims, rightly so, are much more vocal in terms of their needs and what they want, and the fairness of the justice system and the whole sentencing. And then we've always got to look at, well, what happens whenever these people are released into the community or discharged, and what are the services, and are the services the right services in terms of actually tackling their needs. In terms of the McLean conclusions then, they recommended and concluded that special sentencing arrangements then was therefore necessary for this highest risk offenders who were likely to continue to pose a significant risk of harm to the public. And I'm not going to read this out, but the committee proposed the establishment then of the order of lifelong restriction. And Mark, who's the Chief Executive of the Risk Management Authority, is going to talk a little bit more about the OLR as it's referred to. And as a result of that, then, they proposed the creation of a new body, which was the Risk Management Authority, which is what we're here to very briefly speak to you about today. And the tasks and the remit of the Risk Management Authority, and in fairness, we were just speaking to Lord Beckett over lunch, and we were talking about the tall order that it actually is. And it is a tall order because we are tasked with continuously updating our risk assessment, our risk management approaches, quality assuring the individuals that conduct those risk assessments. And it's a tall order, it's a serious task that we have, but it's also the right thing to do. And I was looking at a journal paper going back actually around that time, and it was the Journal of Psychiatry and Psychology, and there was a quote in one of the papers, and it says that much rests on the ability of the Risk Management Authority to research, to train, and to commission appropriate services for such high-risk offenders as the OLR now changes the landscape of forensic psychiatry and forensic psychology in Scotland, and the seriousness of this group and how they are managed. So it is a tall order. I think we've come up to the plate, and we're delighted that we continue, and indeed we celebrate our 20 years. But what is most important is that the work that we do is impactful, and it has an impact. And in terms of how we manage that group of individuals, but also how it impacts in terms of sentencing, and that's the key. So this then led to the introduction of the Criminal Justice Act 2003, the establishment of the Risk Management Authority, and then obviously the establishment of the OLR, and that came into effect and became available to the High Court in Scotland for the first time in 2006. So just very briefly, our role, the Risk Management Authority role, we publish and set our standards and guidelines for the assessment and management of risk. We promote effective practice. We carry out and commission research, and I have to say, and I was just mentioning to somebody at the break about the amount of research that goes on within the RMA, and this is really, and I can say this as the convener, it is glass ceiling research that I think is really happening across the RMA that is highly impactful, and I'm very proud as the convener to be able to stand over and to speak about that research and the impact that we have had. It allows us to take on many pilots, and lastly and importantly, our role, we have a very important role in terms of advising and making recommendations to ministers, and we're always very keen to look at that. And one of the things we've spoken a lot today about is the prison population, and I'm going to very briefly touch on that. In terms of our strategic aims, everything that we do is about the evidence. Everything that we research is looking at how the evidence is making a difference in terms of reducing that harm. It's important that our risk assessments, in terms of the standards that we produce, meet the needs of that particular client group. We are constantly sharing our learning and conducting training across multiple agencies. And I think one of the most important things in terms of the training and the work that we do in risk assessment, risk management, is the whole use of language of risk, how we use risk assessment and how professionals talk to each other about what we mean by risk and what we mean by risk management. And lastly, we've talked about very briefly how we make a difference and how we influence, and also sometimes looking way ahead down the train track in terms of the kind of trends. And we've talked about, Sarah, you talked about the lack of evidence, but the multitude of data. And I think what we need to do is combine all of that and look to see how it conjoins, and it can really begin to look at those predictions of what do we need to tackle next. Because I'm very clear, and I know, Rachel, you will agree, that how we, for example, tackle domestic abuse maybe 10, 15 years ago is very different to how we actually deal with those specific cases now. So as I say, we publish our research. If you look online, we have many directories in terms of the risk management approaches that we use, and I was delighted to hear over lunchtime, speaking to somebody, that they say they use our directories often and refer to the research that we have. We collaborate with our researchers, and we work with a lot of victim agencies in terms of enhancing understanding and that public safety. And most importantly, we use the findings to develop and support practice. We work with the Scottish Prison Service and Scottish Government to ensure that the risk management standards that we set, that are met through the OLR plans, and they are implemented, and using the data correctly to make that impact. And lastly, the quality of the quality assurance pieces is so critical. In other words, getting it right, because as I always say, getting it wrong can be catastrophic, can't it? So it's really important that we have that quality assurance over our assessors. The training is around risk-based decision making, and obviously evaluating then the training and the impact that has, and creating and maintaining an accreditation framework, which is really important for those that are actually out assessing. So we have a number of psychiatrists and psychologists that are accredited assessors for the court, and we make sure that they are accredited. And lastly then, in terms of influence in policy and practice, working with all our Scottish partners and indeed beyond, and it was mentioned this morning, that we need to do cross-jurisdictional work and we need to work with partners. Somebody mentioned the need to work across health, because as I always say, there's no health without justice and there's no justice without health. If you look at the amount of people that are coming into the system, as I always say, people just don't come into the justice system with problems. They have come through various other massive machines and systems, such as health, such as education, such as difficulties with employment and housing. So they don't just reach the justice system with a plethora of problems. They arrive at the justice system with their problems, and for all sorts of reasons that we all know about. This is just a pictorial kind of journey of our 20 years, and you'll see there, I'm not going to go through these, but I just think it gives you a lovely kind of overview of all the work that we have been doing and the kind of milestones there. You'll see 2006. The first order of lifelong restriction was made. 2006 again, the establishment of the Risk Assessment Tools Directory. 2014, we've got a very young Mr. McSherry there. In 2014, which is the Multi-Agency Public Protection Guidance that published by the Scottish Government, which incorporated our approach, which we were delighted about in terms of risk management. And all the way through this, you will see all the different examples of the research that we have done. So my question then, how does all of this work and everything that we've spoken about today, how does it impact in terms of sentencing, public protection and rehabilitation? Because we can't talk about one without talking about the other. Everything that we do at the RMA is based on research and evidence, which obviously promotes that confidence. And we talked about confidence in the justice system, confidence in the sentencing, and does it follow? Is there a formula to this? So my questions: evidence, the effective practice follows the evidence and the research. So in other words, what we must do must be grounded in the research. Going back to the what works. So what works with different types of offenders? Are we delivering effective practice that's based on that research? And if not, why not? There's a risk. Effective sentencing, therefore, follows confidence in the evidence and the research. So what are the sentencing trends for different offender types? And what is the sentencer confidence in terms of the research and the evaluation and the evidence? For example, community sentences. Public protection then follows effective rehabilitation approaches. So if we have the right rehabilitation opportunities, we have the right people delivering them to the right people. Because somebody mentioned today, could have been Professor Hamilton, I can't remember, but it was around the fact that sometimes a prison sentence is not the most severe sentence. And I know that from my own practice, that I would have, when I was starting out, delivered lots of treatment programs, sex offender treatment programs, domestic abuse programs, all of those types of interventions. And sometimes the individuals that were given a community-based sentence, such as a probation order, with a condition to do a specific treatment program, often used to say, I would prefer to go back to prison, this is too hard. And actually what we were asking of them, we were asking them to come to treatment 2 nights a week, and actually to sit and to disclose their vulnerabilities, their offences, and sometimes very, very pardon me, uncomfortable things about their sexual offending. So that was a hard sentence. And I think that's where the debate is, you know, what is it that we want people to do? Do we want them to be rehabilitated? And if so, that's the task. And often community sentences are really hard work. And public protection then, it follows that effective rehabilitation. So I think it's really important that we look at those rehabilitative approaches and ensure that they are actually meeting the needs of individuals, as opposed to they're there and one size fits all, because one size doesn't fit all across the system. And ultimately, we need to look then at the reduction in reoffending, because that follows that if we get all of the above right, it improves public confidence in the justice system, which therefore creates a safer Scotland, it creates a safer community, and everybody has a good outcome. The question, though, is, are we following this formula, and is it working? So what I want to do, and just very briefly, is give you just a couple of examples in Northern Ireland, and what I don't want to do is come over here and tell you what we do in Northern Ireland, and please don't think that I'm doing that. I'm doing it because I am here as the convener of the Risk Management Authority, and I have things that I'd like to share that I think have worked. So Northern Ireland, we discovered many years ago that we had serious problems with people going to prison on short prison sentences. At one stage, we had 88% of the prison population were on short-term prison sentences, and 51% of them were reoffending within a year of release from prison. The then Lord Chief Justice, Sir Declan Morgan, put a challenge to the probation board to come up with another sentence, an alternative sentence that could address all of the things that we were going on about, such as too many people in prison with mental health problems, with addiction problems, etc. So we developed what's called now the Enhanced Combination Order, and the Enhanced Combination Order does exactly what somebody this morning mentioned. It gets to the root. I think it was yourself, Mr. Evans. It addresses the root causes of the problem, as opposed to the consequences. So what we have done is introduced an enhanced combination order, which I'm very briefly going to talk to you about, problem-solving courts. And I'm so delighted to be here to meet up again with my dear friend, Sheriff Fleming, who helped us set up our first drug court over in Northern Ireland with his colleagues. So problem-solving courts work, so they do. Huge amount of evidence, which I don't have time to go into today. Unadjudicated interventions around people who allegedly perpetrate domestic abuse. And we have done a lot of work with our Department of Health, our health services, and training people whose children whose clients are usually men whose children are on the Child Protection Register, who are alleged perpetrators of domestic abuse and who are potentially on the cusp of coming into the justice system. These interventions are about getting upstream and actually intervening early to avoid them coming into the justice system. And last initiative I wanted just to mention was the Family Justice Centre that we have in Northern Ireland, which is the first family justice centre across the UK. It's a US initiative which we brought over to Northern Ireland, and it incorporates all of the agencies working together for people who have perpetrated domestic abuse and also for victims and families, and obviously not all together. Very briefly, because I know I'm going to be told to sit down. We know the strong evidence that community sentences are much more effective and much more cost effective in terms of prison. They allow the opportunity to address those root causes, and they allow that opportunity to ECO is they allow the opportunity to interrupt the cycle of offending, and we know we don't have to. I'm preaching to the converted here in terms of how that the impact of short prison sentences, and they rehabilitate, and that's what we want. And I'm not going to go through. I can speak about this possibly in the plenary, because I know I'm going to be told again to sit down. But lastly, just before I do sit down, what we find from example of the ECO, the Enhanced Combination Order, all types of offences, all types of offenders that were considered. So in other words, the sentencers were asked, if you're considering an order of 12 months or less, consider an enhanced combination order. The research findings are that the duration of these orders was between 24 and 36 months, mostly males. The outcome that we found when we did an economic impact evaluation was that those that received ECOs reoffending rates were down 10%. Is it cost effective? Yes. The economic impact evaluation that we commissioned found that the cost of an ECO was £9,000 compared to a prison sentence of roughly £50,000. So that's a kind of no-brainer. And an expected benefit of between 5.7 million and 8.3 million per year if ECOs were going to be introduced as alternatives to short prison sentences. We found that those where the ECO pilot showed a decrease in 12 months sentence or less of 20.7%. Does it rehabilitate? Yes, they do. 87.5% reported that it increased their mental health, access to services. There was a decrease in terms of their reoffending. And also, there is a significant population that didn't go to prison. So within that pilot area that we were conducting, just under 1,000 people did not go to prison. And as a previous prison minister said, and we have heard it today, we all experience the same problem across the jurisdictions. We've all got the same problems with short prison sentences, we've got the same problems with the remand population, with the complex needs of people with drugs and alcohol peddling through that justice system. But as he said, short prison sentences are long enough to damage you, but not long enough to heal you. And I often think that's an interesting quote in terms of, because we don't always have time, I think as you pointed out today, to do what we want to do in prison to rehabilitate people. Is the community option a safer option? So what I'm going to do now is pass over to Mark, who's going to go into the detail of the OLR and some of the work that we do. And thank you very much for your time.
Hi there, can I just check everybody can hear me? I wanted to point out to begin with, one, I didn't put that picture of me up there, it was a comms officer. Two, yes, it has been a very hard paper round. And three, for all of you that are as hot as I am just now, I'm hoping to look like that at the end of this session as well, given how hot it is. Thank you very much for having us. I'm going to, in about 12 minutes, give you a quick overview of the work that our research team have been focused on. A research and development team headed by Jeff, who's down the back, who I'm sure will be happy to talk about the variety of projects that are ongoing. I was having a little bit of panic early on, thinking that this wasn't going to work, because one of the slides is hugely dependent on it. And just to point out, about 3/4 of the way through, there will be a quiz of one question. The prize is still to be determined, so if you want to pay attention, I know some people have seen aspects of this before, but there are new slides, so we will do a check. I'm going to focus on 4 key elements of how our research is being used and has been used to inform different parts of the sentencing process. So the first area focuses on pre-sentence reports in relation to an online project that we're involved in. The second is then in terms of short-term and long-term prisoners and advice that we're looking to provide to ministers in relation to the prison population and some of the challenges relating to that. And then lastly, a very quick overview of a lot of the research that we're doing in terms of the order for lifelong restriction, which we believe is not just useful for our focus on what improvements are required for that sentence, but what implications are there for other life sentence prisoners and also long-term prisoners. So I will begin with one of the quotes in relation to research that we use very often. I was interested in some of the questions earlier on about the media. So for those who are aware of Carol Hansen's work over in the States, he's undertaken a variety of meta-analysis which demonstrates that for individuals who are convicted of sexual offending, that if they remain offence-free for 10 years in the community, they're as likely as anyone in this room or the public to commit a sexual offence. And it's in this context that we are quite keen that our advice and our research is based on looking beyond just these broad terms of sexual offending. And one of the first projects that we've been focused on is in relation to trying to understand the specific risks and needs that individuals pose across a spectrum of different sexual offending behaviour. The first project related to, there was a thematic inspection of multi-agency public protection arrangements way back 2015 or thereabouts, and from that one of the recommendations was that practitioners, both justice social work and police and others involved in offender management, were indicating that they felt they needed more confidence in relation to how they assessed individuals who'd been convicted of online offending. So our team was responsible for doing a lit review, and I heard the mention of artificial intelligence earlier on. This lit review took, how long, Jeff? Was it 2 years or thereabouts? And then we did a test relatively recently on AI to see how much it would come up, and it was relatively close. I've been used to the words artificial intelligence for a whole different reason, given my background, but I'm now beginning to become aware of some of the benefits and how we can use it in terms of developing the evidence base. So for this particular project, we looked at a variety of typologies of those convicted of online offending or of those who had downloaded indecent images of children. And particularly one of the questions that was being asked was to be able to determine from the research what was the difference between those who went on to commit contact offences versus those who remained online offenders. So we looked at the whole variety of different typologies. We looked at some of the specific risk factors which seemed to suggest there was a difference in being able to assess individuals who would be more likely to go on to commit contact offences. And these are some of the factors that were very specific, and being able to say if you're able to assess those factors, then the information that you can provide in your pre-sentence report would be more meaningful to those making judgments in terms of giving an indication of those that would be likely to go on to commit this type of serious harm. So from the lit review, we did a variety of searches of the literature looking at the trajectory from those who committed non-contact offences, and online offences, and what did they go on to commit. So as you will see from some of these lines, it shows the general trajectory of those and their offences. But when it comes to online offending, you'll start to see that the figures are relatively low. So 2% going on to commit contact offences, 3% in this other study, and then in this study 3%, and then up to 3.9%. And similarly, when you then looked at those who went on to commit online offences, by and large, very similar figures. So way beyond 90% did not go on to commit further sexual offences, and if they did, they were most likely to be convicted of the type of offences that they had committed before. There was also a very similar study, a far larger study down in England and Wales, I think it was at 14,000, which verified these figures as well. So when you started to look at the trajectory of those who committed online offences, you will see that very few went on to commit contact offences, so 0.9 and 0.2 were some of the figures, and then the majority going on to commit online offences as they had been originally convicted of. So from that study, the message to the multi-agency partners was that by and large individuals will not go on to commit contact offences. Different methods that we would look to test. Geraldine mentioned we have these pilot methods. We ran a pilot in a number of local authorities looking at trying to identify these factors at the court report stage in order to then inform the sentencing in the court reports. So the various stages of that project involved 8 local authorities. This year we've concluded 4 different aspects of that study that looked at the reliability of the assessment method, that looked at the inter-rater reliability, and one of the outcomes of that is that people like our colleagues in the Scottish Government are now looking to update the Justice Social Work Guidance to reflect some of the differences and what this research has found. Also, we've just hosted in the last few weeks a number of awareness sessions with Justice Social Workers about the findings of this research, going back to the original recommendation 10 years, to try and give that confidence in an area where the research is relatively clear in terms of the likelihood of individuals going on to commit contact offences. That's some of the work on pre-sentence. We're also, as you would expect, involved in the Criminal Justice Board and discussions about the prison population and some of the challenges that that poses, given the Justice Vision's aspiration that custody should be reserved for those who pose a risk of serious harm. So based on the information that we are providing to the Criminal Justice Board, I think this is going to be going to them in the next couple of weeks, we've been looking very tentatively at short-term sentences, because one of the challenges in the prison system is short-term prisoners, by and large, will not necessarily have an assessment. They may have an assessment at the court report stage if a court report has been requested, and you can start to look at some of the proxies of what was said at the court report stage versus then what then happened. And our interest there is really, as they're looking at various options, there's obviously been emergency release, there's been the changes to automatic early release, is to try and use the information in relation to risk that might be pertinent to options for ministers and Parliament and others. So as you'll see on this here, I think it was only 23% of the assessments that we could find, so it was 163 assessments, was the recommendation that community disposal was not feasible. And you'll see the other figures, 56% recommending CPOs, etc. So the majority of those who had been assessed were determined that community disposal was feasible. And I guess there's different questions there, and I'm aware of the other pillars of justice. This is just one element of that a sentencing sheriff may have to take account of. But in terms of further options, both for short-term prisoners and long-term prisoners, part of our role, as we'll link in with the Penal Commission, is in trying to provide some of the evidence in relation to risk assessment. What we have far more information on is long-term prisoners, which are those serving sentences of 4 years and more. So within our approach and the publications that we've had over the years, as our concern about risk increases, so should the level of scrutiny and analysis that's undertaken right up to and including the risk assessment reports that are undertaken for those being considered for the order for lifelong restriction. And similarly, that triage approach applies in practice within MAPA as well. So within the context of risk, we're looking at both the likelihood of reoffending, but we're also looking at the impact of that and whether that impact is catastrophic and may cause a risk of serious harm. And from our perspective, the information gathered through that risk assessment is absolutely about being that communicated meaningfully to decision makers, not using labels of high, medium and low, unless everybody absolutely knows what that means, but describing risk in terms of the pattern, nature, seriousness, likelihood and imminence of offending to inform those decisions. So from that risk assessment process, I'm going to flick through these because we have about 5 minutes left, and I want to show you some of these slides. So in MAPA, we use these definitions when we do use those labels. So this is describing seriously harmful behaviour. The overall definition of seriously harmful behaviour that is used is about serious sexual and violent offending, which has a lifelong impact from which recovery may be difficult or impossible. And then the assessment conclusion allows the assessor to then assess against these levels. So essentially low would indicate there have been some indicators that we have investigated, but actually now we believe they are no longer relevant. Medium, the conclusion would be there are factors there, but there's stability. And unless there's a change in that stability, they would remain at that category of medium. And then high is absolutely there are indicators of risk of serious harm, and it's going to happen now, or it's going to happen very soon. So the reason I'm using those definitions is we looked at the risk assessments of those on long-term sentences, and this aspect here is about community as well as some of the work we're doing in prison. So that gives an overview of the risk of reoffending of those in the community. It also gives an overview of the risk of serious harm conclusions. So you'll see within this there's already 51 individuals in the community who have been assessed as posing a risk of serious harm, and that is going to happen very soon or imminently. And there's also 73 where there are indicators, but it remains stable. And then there's 14 where there is no indicators that they pose a risk of serious harm. And I guess the reason for that is we know in MAPA that communities are well experienced in working with seriously harmful behaviour. But when we look at the prison population, it poses a few questions in relation to if we are aspiring to the aim of the justice vision of reserving prison for those that pose a risk of serious harm. We can see from the risk profile of those who don't pose a risk of serious harm, there's a group there of nearly 500 individuals who are assessed as not posing a risk of serious harm and have either very low or low risk needs, which means there's very little input required for them. And the reason that we're using that information is to then look at, in terms of the design of the prison system, how do we design that proportionately to then be able to address this population, but then also work with those who have higher intensity risk and needs. So these figures were taken from, I think it was in February, we looked at that when the prison population was 8,289. Who would like to guess how many individuals pose the risk of serious harm at that point in prison? Any guesses? So it was 8,000. Only 4,000 assessments were available. Any guesses? Jeff's not allowed to guess because he knows the answer. Okay, of the population, there was broadly just over 1,000 of the 8,000 where we know on the basis of an assessment that they were assessed as posing a risk of serious harm. About half of the prison population will not have assessments, either by the nature of being short-term prisoners or by the fact that they're there for bail, remand, etc., where they won't have a risk assessment in place other than the information we have on short-term prisoners. But by and large, that would demonstrate that there was 619 who posed a high risk of serious harm, i.e. there was identifiable factors and it was going to happen soon, and then a further 86 where it was happening now. Of that information, we now know from that 4,000 population, and again, we're looking to use this information to look at how the prison system then operates for those who do pose a risk of serious harm, but also for those other individuals who do not. And one of the other areas that we are looking to use our intelligence on in relation to that is the significant information that we have about the order from life long restriction. And that involves not just the information we have about the risk assessment reports which are conducted when that's been considered, but also the ongoing implementation of that sentence from the point that a first risk management plan is required within 7 months of someone receiving that sentence, and then the ongoing reporting of that annually. And I'll just use 2 very brief stats on that, and we've got plenty more to show you later on. So in terms of the OLR, we looked at the offending profile of those on the OLR, and that considered not just index offending, it considered previous offending, it considered, as you know, for the OLR, one of the unusual aspects is that allegation information can be considered as well. And the outcome of that was that it verified, and we published this 3 years ago or thereabouts, that by and large it demonstrates that the order for lifelong restriction population is a complex population based on offending characteristics. So you'll see around a fifth of all types of offending, be it sexual violence, intimate partner violence, general violence, or other types of offending. And one of the reasons we want to understand that is not just in terms of whether or not the sentence has been targeted at those it was intended for, which this report indicated by and large it is focusing on those complex individuals, but also what does that mean for their treatment thereafter in prison. So similarly within that study, it looked at the duration of the offending, and as you might know, part of the risk criteria that's then applied when someone does a risk assessment report is considering whether or not there's pervasive lifelong traits which may not be amenable to change. And quite often you'll see that in sentencing statements, that whilst the punishment part is set, there is also an indication given about the fact that they may not be released until that risk is considered manageable by the community. And I was conscious of some of the other differences there, that whilst the parole board ultimately make that decision, they also have to have a regard to the risk management plan and can take a decision contrary to that, but they would explain the reasons for that, which is one of the differences for this sentence. But I think it also demonstrates the pervasive nature of risk for some individuals where that offending can be 20 years, 25 and 30 years as well. But lastly, one of the projects I wanted to focus on is not the study on reintegration, which had 3 broad themes, and we're doing further work on that. It found that the experience of prison was a never-ending journey. It did find, however, that there were positive aspects of community management, which again, going back to Cyrus's point earlier on, I think there are aspects that we really do need to be capitalising on that have been found in various inspections as well, in terms of how strong multi-agency public protection arrangements are in Scotland, and I think we also have a role in trying to use our influence to develop public confidence in that respect as well. But the one last study I wanted to very briefly focus on as a result of this was that we looked at and are looking at an audit of OLR cases. So initially we've looked at 15 from the beginning to the end. That was the ones that got it 20 years ago, looking at the risk assessment report and then the risk management plan and considering the various facets of what has or hasn't been implemented in order that we can give recommendations to ministers. So one of the factors within that is I was really delighted to hear the word responsivity earlier on. I remember 15 years ago I was on a working group with a sheriff who shall remain nameless, and he challenged that that wasn't actually a word. And he was right, because I went and checked the dictionary. It doesn't exist in dictionaries, but essentially responsivity are, as you know, the potential barriers to someone engaging in treatment. So it can be a variety of personality disorder, cognitive functioning, trauma, etc. And we're looking at all those aspects for those on the order for lifelong restriction. They'll be identified at the risk assessment report and then the subsequent risk management plans. And interestingly, we're beginning to see again the complexity of that population. So just now, some of this is focused on personality disorder, and in particular, we're about to publish a study in the next few months which focuses on the prevalence rates of psychopathy. And as you'll see for the OLR, the prevalence of psychopathy and the order for lifelong restriction is significant. I think in total, broadly about 70 above the 25% cut-off. And whilst that's a different population from some of the other studies, I think it demonstrates some of the complexity for the prison service in being able to address some of those barriers. But that is just one of the barriers that we're looking at. Beyond that, we're also looking at adverse childhood experiences in custody. And it was interesting, actually, one of the points for the order for lifelong restriction, I think one of the other colleagues made, is that while someone then may be subject to management in prison, quite often a significant proportion will go on to continue to offend within prison. The area that we're particularly interested here, I guess, is using this research to give advice to ministers and to work with the Scottish Prison Service and the local authority on how do we support progression, how do we tailor individualised approaches for those on that sentence but also others, and how might that support the aims of the prison population being reduced, but being done so on a basis of safe evidence that informs that. So in summary, we know that the OLR is a complex offending profile. We also know that they have a variety of responsivity needs, and we also know that they go on lots of programmes, but come off the programmes untreated. And part of our hypothesis is we need to be looking at a system that is then tailored to deal with the specific responsivity needs, not just of the OLR, but in order that treatment then has an impact. And I think that's one of the challenges given, going back to the risk criteria for the order for lifelong restriction. At the sentencing stage, if you've been designated as high risk, part of that criteria is you may not be amenable to change. So part of our focus is trying to look at, for those where that is the case, what individualised work can be undertaken in order that they can safely progress. We are concluded the 15 study. We're about to send that to our colleagues in the Scottish Government and also to the Prison Service. We'll be concluding the 50 study round about summerish, autumn thereabouts, and we'll be hosting an event in October. We'll be focusing on those findings. We have previously given advice to ministers. We did a review 10 years after the first sentence. Some of the specific recommendations, which chime actually with the work that Scottish Sentencing Council have done, was that we had made a recommendation at that point that consideration should be given to assuming that those under 21 should not be considered for the order for lifelong restriction. The McLean Committee originally looked at that, but did not then enter that into legislation. Given the sentencing guidelines, we will continue to lobby and work with others, such as the Centre for Youth, I've forgotten your name now, Fiona, CYCJ, to look at how we can affect change in that particular area. We have a number of resources on our website. There's a few research projects. There's directories that Geraldine mentioned. We also have podcasts. We've went very modern and trendy, but don't listen to the ones from myself. And there's also a number of resources there which are about explaining what the OLR is and giving information to different groups who have an interest in that. What I would say is I really, really welcome the engagement we've had with the Sentencing Council over the last few years. I was talking to a few colleagues before, not just in the working groups and the various sentencing guidelines that have been developed, but I think there has been a really close, collegiate, collaborative relationship focused on how do we use this research evidence to influence not just sentencing guidelines, but also policy and practice. So thank you very much.